Well, I've got to get to the studio. You know, our religion, our faith, has to address the environment, has to address the community, has to address issues of poverty. What are some of the things you liked about Chicago?
Oh, the Art Institute.
And one of the things I know that you and I share is Chicago.
This is true.
Really distinct goals. Our primary interest was in campaign finance reform, but we were also interested in election law and in civil union.
Have better and cleaner politics in Oregon. Dan, good to have you on Speaking Frankly. You know, that's the thing is, we as human beings live together on this planet Earth.
Right.
We also live together in our societies, in our nations, in our communities. Welcome to Speaking Frankly. Well, here we are. We're now into summer. We know that this is now a true season of the year. And as my special guest today, I have two persons who are very active in the Yamhill County Democratic Party, and we're going to talk about health care. Liz Marlia-Stein, who is a substitute teacher in the public schools. Just delighted that you're on Speaking Frankly. And also, now let me get it right, Jason Van Pelt. Jason Van Pelt, you work for the Newburgh Public Schools, is that right?
Yes.
Yes, okay. Well, great to have you on Speaking Frankly. And that's what we're going to do today in considering one of the big issues that is there for all of us in terms of public health or a public health plan for everyone. Now, we had a marvelous meeting at your home last night. I was so impressed with the discussion and all the information that came out. I thought we really needed to share that with a larger audience.
Thanks, Frank.
Tell me now, what got you, Liz, what got you interested in a public health plan for all U.S. citizens?
Well, basically seeing a number of people without health care and having so many medical bills that they cannot afford, and then ultimately having to claim bankruptcy or just hurting. People just hurting. And it's just time that we stop thinking of ourselves and start thinking of other people.
Now, this isn't a new idea, is it?
No.
Universal health care in a nation. I mean, didn't England start this right after the Second World War? Isn't that something in their most desperate time? Yeah, they launched this plan. And, excuse me, of course, also our neighbor has it just to the north there in Canada, doesn't it?
Yeah.
Now, tell me, Jason, right?
Yes.
Jason, what got your interest in a universal health care plan for the U.S. of A?
It just seems to make sense. You know, I mean, I also have friends and have known people who've had problems with health insurance and problems getting basic coverage for what they needed, having to struggle just to get common ailments treated sometimes.
Yes.
And it just makes sense that health coverage should be something that we can expect, just like we expect clean drinking water, we expect the fire department to come when our house is burning down, we expect the police, we expect the military to protect us. We should be able to expect health coverage for all of us. There shouldn't be any circumstance where you have to suffer treatable illnesses or die from a treatable ailment simply because you don't have enough money.
Yes. As citizens of the U.S. of A., that ought to count for something. Now, as citizens, we will pay for it with our taxes, and because actually we're involving others with their lives in providing medical services. Same thing in terms of the drug treatments, etc. So it's not free. We're all going to have to be involved paying for it, but we should all be receiving it.
Right.
Yes. Now, you're a public school teacher. Tell me, as you and you've been a public school teacher most of your career, haven't you?
A substitute teacher.
A
yes.
substitute teacher. Yes.
I chose that because I have 5 children and wanted to be a mother first.
Okay. So you're a mother and a teacher, and a mother first.
Yes.
Okay, that's beautiful.
And now grandma.
And now you have a family. That's beautiful. Now, as a mother and as a teacher, working with youngsters every day, every week, yes, what has been your experience here when you see an ill child?
Just the need for them to be treated, the need for them to feel that they are cared for. And there's a number of children who come into our schools that it's obvious that they do not have the money or the care that they need to be a part of the whole. And it's just time. It's time for us to think of one another and to do a little bit, to set forth a little bit of what we have. So, you know, if everybody helps just a little bit more, then there's just so many more who benefit.
So no one in this democracy of the U.S. of A., the United States of America, should be faced with living without the option of health care.
Right.
Do you agree with that, Jason?
Without the affordable option of health care.
Affordable option of health care.
Yeah.
Yes, we know it has to be paid for,
Yeah.
and we know that as citizens we ought to be part of the paying public, and we ought to be paying according to what wealth we have, or some proportion of it. Now, doesn't that make sense?
Yeah.
Why should anybody, whether they're a youth or a child or a senior, go without health care simply because they have no money or not sufficient funds
Right.
for health care? What is it that you think we could be about right now to help bring about universal health care for this nation?
Kind of two sides to that question, aren't there?
Yes.
One is just the will to want to do it. And I think when you look at all of the polls that are out there, of what the average American says they want, they say that everybody should be insured. And that's just not the anonymous person on the street. It's my family members too. It's my brothers and sisters and whoever who may not be able to afford it. Everybody agrees on that part of it, and if we get behind it ideologically, we say this is what we want, and make our will speak out louder than the will of the insurance companies who are profiting and who may be holding back on some of this because insuring everyone is not as profitable. That's one side of it. The other side is financially, what can we be about? How can we make it happen? And like Liz says, part of it is we have to be willing to make a little bit extra sacrifice. But truthfully, if you look at the numbers on that, we already are. When you look at the numbers, it's almost as expensive to cover uninsured people in the emergency room as it is to just give them health coverage from the start and get them treated before it gets serious.
Yes.
Things like that.
Before they have to go to emergency.
Yeah.
Right. Preventative care is so important, and that's one aspect that we don't have. I've always been under the contention that every single person in our country should have one doctor's visit during the year where they can go in for a preventative health checkup. Just one.
Well, that happened to me in the Depression. I was born in 1927. My mother ran a rooming house. That's how she supported the two of us. But when I was 7 years old, I was a skinny kid. And she thought maybe she needed to see the county doctor. We had a county doctor for Kent County. Grand Rapids is